starting with bunions.
Yes.
You've mentioned the fact that you've dealt with these, still have them, or at least one. What are they? And then for somebody with one, what's the best they can hope for?
So a bunion is, a lot of people think that a bunion is the problem where they see the bump. Okay, we're talking about a hallux valgus. So this is on the inside of the foot. A bunion is an instability in the transverse plane of the foot. So basically what I mean by that is when your foot hits the ground, it has to be strong. It has to be able to control all the different motions that our foot goes through. And when we don't have that stability, when we go to walk, the joints start to change, if you will, and we can start to get a shifting of the metatarsal of the first bone there, and you start to get this bump formed. Okay. If for those of you with bunions, if you were to look down at your nail bed, okay, so when you look at the nail bed of the big toe, sometimes that nail bed will be flat and it'll be diving in. So it'll just look like the toe is flat and going in. Sometimes that nail bed will look like it's rotating, where it's not only is it going in, but there's this rotational shift to it. When you see that nail bed that's shifting, that's rotating, you can be pretty certain that you're not controlling the rotation of your body because you're seeing this bunion start to form as a result of that. If there's no rotation and that nail bed is flat, you better take a look at your footwear because the footwear does change the structure of the feet. So when we think about bunions, we want to look at how strong is the foot and the right footwear. But then the other thing that I think a lot of people miss is, do you have bunions on both feet? Because if you do, you better be looking at who's driving the car, because that's your pelvis and your hips. That's why I always tell my patients, it's never just a foot problem. And they'll be like, well, my grandma had a bunion, so, and I said, hold up, time out. Okay. You don't come out of the womb with a bunion. You might have had connective tissue laxity or hypermobility, those types of things. Those genetic things can be inherited, if you will. But, you know, when you go to the doctor and they say, does your grandmother have heart disease? And you say, yes. What do they tell you to do? Better eat right? Better exercise. If you have a genetic disposition for heart disease, it's the same conversation we should have with bunions. If you know your grandma has a bunion, take proactive measures. Wear the right footwear. That is a non-negotiable, that you are in a wide toe box shoe. Strengthen your foot. And also think about what's happening at your pelvis. So if you were to stand up and take your pelvis and think about the pelvis as a bowl of water. If I were to stand up and dump out all the water, so this is called an anterior tilt, or I'm kind of arching my low back. What you should feel there is your arches start to drop, and you should feel more pressure on the inside of the foot. Okay? You might even see an increase of the angles of your bunions. Anterior tilt is not bad. We have to be able to do that motion. We just don't want to live there. So we should be able to control our pelvis, tilting it forward. We also should be able to tuck our tailbone. Now, if we're standing and we tuck our tailbone, there is a direct correlation between what your pelvis and hips are doing and what is happening at your foot. Because when you tuck your tailbone, you should feel your arches lift. And you should also see your bunion, if it's flexible, start to straighten out a little bit. So when I see people with bilateral bunions on both feet, I'm not only looking at how I can improve strength at their foot, but also, do we need to work on strength of their pelvis, motion of their pelvis, strength of their hips? And usually that answer is yes. So there's a lot that can be done. Toe spacers are so incredibly helpful. I wear them every single day. It took me 6 months to wear them every day because my foot was so weak and it was so uncomfortable. After about 10 minutes, I was throwing that thing across the room. But the reason I still wear them is I was late to the party here. My bunion had already formed. It has decreased. And like I said, there is no pain, but I like having that spacer in there to keep my toes aligned. And those spacers can be worn in every single shoe we've talked about today, whether it's functional or minimal. So those are all little important things with people that have bunions. The footwear, watch the tops of the shoes. So this is another little trick. When you look at your footwear, the upper of the shoe, so that's the material on the top of the shoe, try to get something that's flexible, like whether it's made out of mesh or some type of material, because a lot of the footwear will have seams or leather seams over the inside of the big toe or the outside of the pinky toe here. So the foot can't expand. And so every time they walk, the foot pronates. That's a good thing. And the forefoot expands. If you are in a shoe that doesn't allow that expansion, don't be asking yourself why your foot hurts. I'm telling you, it's because you don't have the expansion at your forefoot. It's one of my favorite things to treat, especially when they're caught early. That mild to moderate bunion formation. And this is the last thing I'll say about it, because I could turn this whole podcast about bunions, okay? There's a muscle on the inside. It's called abductor hallucis, and it straightens the big toe. So in my office, I'm giving people exercises for abductor hallucis so that they can strengthen the muscle that's going to help straighten their toe. We would do that anywhere else, right? If I had a difficult time lifting a weight, I would say, go do some bicep curls. Every time you think about your foot, think about what I would do at the rest of my body. So you can strengthen your foot. You can strengthen these muscles that will help balance your foot better.
One of the unique things of a bunion versus a neuroma or a stress fracture is that you can actually see the physical change.
Yeah.
Somebody implementing what you just talked about there, how much of that is reversible?
To reverse a bunion?
Yeah, to actually see it physically go back to a normal state, or is that not even possible?
In your mild stages of bunions, you will see changes to the foot. In your mild stages of hammer toes, you will see changes to the foot. With mine, when it's irritated, like if I were to wear the wrong footwear, when I'm in my cycling shoe, for example, which is still a wide toe box cycling shoe, the toe will get irritated. You'll see inflammation. Those things can all change. But early intervention is the key. I always will look at patients with bunions and see if it's flexible. Okay, because what can happen is this big toe will start to creep under the second toe. And once that starts to happen, and the big toe gets stiff and rigid and you cannot move him, it's a very different conversation. Because now you can't move the toe. We know there's going to be an increased risk of falls, balance problems. We don't want people's feet to get to that point. We need to have a proactive conversation, not a reactive one. I think, I'm probably dating myself here, but when I was younger, they used to do scoliosis checks in schools. That you'd go to the school nurse, they'd check you for scoliosis. We need to be looking at our kids' feet, because if we had them in the right footwear and we let their feet feel the ground and get stronger and develop naturally, you'd probably put me out of business. Throw me into retirement. because a lot of what I see is a result of something that I think can be changed if we just paid more attention. So that early intervention is very important. And, start small. I think I don't want people to listen to this and be like, I got to throw away all my shoes and I need to. That's not the conversation. It's little bits. Get yourself the right pair of shoes. Walk around barefoot a little bit at a time. Start to feel what it feels like, and you'll be able to see difference. A lot, actually. I mean, the brain is plastic. It's a conversation of hope.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
The reason I got into this work was because of all the foot pain that I've had. And I'm working real hard, Jesse. I'm working real hard to get this information out there because it changes people's lives. If you go look at all the popular footwear now, it's like a pillow party.